This medication is used to treat cystic fibrosis in certain people who have an abnormal CFTR gene. It may help to improve breathing, reduce the risk of lung infections, and improve weight gain. The daily dosage and optimal timing for taking this medication may vary depending on individual circumstances, so it's important to follow the instructions provided by your healthcare provider. Before you start taking Ivacaftor, be sure to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily, every 12 hours. If you are taking the tablet form, take it with fat-containing foods. Swallow the tablet whole, unless your doctor tells you otherwise. If you are taking the granules form, gently shake the packet before use and mix it with a small cup of soft food or liquid. Take the entire mixture within 1 hour of mixing and eat a fat-containing food either right before or just after. The dosage is based on your medical condition, age, weight, response to treatment, and other medications you may be taking. Take it at the same time each day to get the most benefit from it. Avoid eating grapefruit or drinking grapefruit juice while using this medication, unless your doctor says it's safe to do so. And be sure to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Ivacaftor granules in packet include dizziness, headache, or nausea. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as changes in vision. Ivacaftor may also rarely cause serious liver disease, so it's important to seek medical help right away if you experience symptoms such as persistent nausea or vomiting, loss of appetite, dark urine, stomach/abdominal pain, or yellowing of the eyes or skin. Additionally, Ivacaftor can commonly cause a rash, which is usually not serious. However, it's essential to inform your doctor if you develop any rash, as it may be difficult to distinguish from a rare rash that could be a sign of a severe reaction. While it's rare, a very serious allergic reaction to this drug may occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not mentioned. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Ivacaftor granules in a packet, make sure to inform your doctor or pharmacist of any allergies you may have. This medication may contain ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have liver disease. Be aware that this medication may cause dizziness. Avoid alcohol and marijuana as they can increase this effect. Refrain from driving or operating machinery until you are sure you can do so safely. It's important to limit alcoholic beverages and speak to your doctor if you are using marijuana. If you have surgery planned, be sure to inform your doctor or dentist about all the medications and products you are currently using, including prescriptions, non-prescriptions, and herbal products. For pregnant individuals, this medication should only be used when necessary. It's important to discuss the potential risks and benefits with your doctor. Additionally, this medication can pass into breast milk, so consult your doctor before breastfeeding. The recommended dosage and best time to take Ivacaftor granules in a packet will be determined by your doctor. Be sure to follow their instructions carefully for the best results. It's important to be aware of how Ivacaftor granules in packet may interact with other medications. This can affect how the medication works and increase the risk of side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are other medications that can affect the removal of Ivacaftor from your body, which may also affect how Ivacaftor works. These medications include mifepristone, rifamycins, such as rifabutin, drugs for seizures, such as carbamazepine, phenytoin, and St. John's wort, among others. It's important to discuss any potential interactions with your healthcare provider. If someone has taken too much Ivacaftor granules in packet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. For Canadian residents, you can contact a provincial poison control center. It's important to address any concerns about potential overdose as soon as possible. It is important not to share this medication with others. Before starting this medication and while taking it, your doctor may conduct lab and/or medical tests such as CFTR gene testing, liver/lung function, and eye exams. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Ivacaftor granules in packet and it has been less than 6 hours, take it as soon as you remember. However, if it has been more than 6 hours, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It is important to take this medication exactly as prescribed by your doctor to ensure its effectiveness. It's important to store Ivacaftor granules in packet at room temperature and away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.